Hi, I'm Dr. Mike from the Springfield Wellness Center, and what we're going to be talking about today is shoulder pain. Shoulder pain can present itself in a variety of different fashions, one of them being an acute injury, a slip and fall on ice, a workout-induced thing, a car accident, something to that extent. It can also come on from chronic repetitive stresses. So baseball players, volleyball players, basketball players, any of those chronic repetitive motions where they're doing the same motion, whether it's a pitcher or any other sport aspect of that, can create some issues within the shoulder itself. We can have acute and then chronic things as well. So acute pains would be something that comes on pretty recent onset, hasn't been there for very long. Chronic wise, we're thinking, somebody that maybe played sports back in high school and now 20, 30 years later is starting to feel the effects of maybe some arthritic type things coming on in from there. And a very effective method of dealing with these can be just as easy as some simple at-home type exercises. And so I've got a TheraBand here, and you can get these at any, pretty much any store, any chiropractor, physical therapy office. And what it does provides a little bit of resistance. Really good stretching / strengthening exercise you can do is just what we call a banded pull apart. Gonna hold it about shoulder width apart, nice wide grip. Keep my shoulders retracted and pulled back. We're just gonna pull all the way back, bring it back out in a nice slow and controlled motion. We're gonna do about 10 to 15 of these reps at a time. At the end of it, you're gonna feel a really nice burn between the shoulders. And what this is doing is helping to strengthen some of the postural muscles on the backside of the shoulder, as well as just taking that arm through a good, strong, long range of motion. We can also add in a little bit of a diagonal pull to it as well, just to hit the muscles a little bit differently. Same thing, about 10 to 15 reps, going in both directions. Nice, slow, and controlled. Bring it back together. Focus being squeezing those shoulder blades back together and then bringing it back in a nice controlled motion. If that's too difficult, take our hands out a little bit wider, a little less resistance. If it's too easy, moving our hands in a little further and getting a little bit more resistance into it. When dealing with shoulder pain, it can present itself in a variety of fashions, one of them being acute type injuries. And so whether it be a car accident, a work injury, or a sports injury, that can present in a variety of different fashions with the shoulder. We can also look at chronic repetitive stresses. So when we're talking about athletes, basketball players, volleyball players, baseball pitchers, or something to that extent, where we're constantly using that arm or that shoulder in a very, very singular range of motion for an extended period of time, can start to present some issues down the road and in the future. A very effective method of dealing with these is going to be checking the spine itself. And so the neurologic connection from the lower part of the cervical spine to the shoulder is huge. That nerve in the lower part of the neck, the C5 to C7 area, controls everything that goes on with the shoulder. So we're talking about position sense, we're talking about sensation, talking about motor control, talking about sensation, everything that goes to the shoulder. If there's a neurologic disconnect between the two, affecting and addressing that neurologic issue coming from the spine, that spinal subluxation, we can then have a great effect on the shoulder itself as well. When someone presents with a shoulder injury, the first thing we're going to talk about is going to be the onset, whether it's of an acute or chronic type nature. Acute type injuries can present from a car accident, a work-related injury, or even just sleeping positioning. Someone that sleeps on their shoulder. When we sleep on our side, we don't typically sleep directly on our shoulder. It's kind of in a forward position, and so that can present and cause some shoulder injuries as well. In a chronic nature, we're usually thinking about old accidents or old sports injuries. Very, very repetitive stresses, such as baseball pitchers, volleyball players can present with a lot of shoulder type injuries going down into the future. An effective method for dealing with shoulder injuries is actually addressing the shoulder joint itself. And so I have my lovely model here, Rainey, and we're going to just demonstrate just a nice light and easy on her adjustment of the shoulder joint itself. And so when assessing the shoulder, there's 4 joint complexes that make up that shoulder joint. We're talking about where the collarbone meets the sternum, the AC joint at the top of the shoulder, the glenohumeral joint, which is the ball and socket joint here, and then also checking and working with that scapula. And so with the scapula, we're just trying to induce motion back into the shoulder blade to get it to where it kind of moves nice and easy when we're raising or moving our arms in a position. With the collarbone, we're going to look right across the very front side here, and so I'm going to have Rainey just raise her shoulders up and down, feeling just for a good equal motion. Same thing with it working with the AC joint. We're going to just kind of check how it bounces, always comparing to the good side as well, the non-injured side, so we always have kind of a comparison. And with this, we're just going to do a nice, easy traction kind of stretch, just trying to reset that collarbone where it attaches, just inducing a little range of motion. Dealing with the glenohumeral joint, we're usually looking at individuals that have kind of a forward pulled shoulder, and so that's where the shoulder's kind of rolled itself forward in the socket. We want to get it back in a nice seated position of that socket, and so the way that we adjust for this, I'm just going to grab the arm nice and light, a little bit of pressure, and a pull backwards. Just trying to reset that shoulder joint, once again making sure that it's moving well afterwards, and then of course always comparing to the other side as well. Patients can present to the office with a variety of different issues when it comes to a shoulder joint problem. Acute nature injuries usually will come from a car accident, a sports injury, or potentially a work accident. Reaching overhead, lifting a heavy box can cause some extra strain to that shoulder. In terms of a chronic nature, we're looking more at sports-related injuries from the past. So high school sports, college sports, even just recreational sports on the weekend, those chronic repetitive stresses can cause issues with the shoulder. Massage is a very effective method when dealing with shoulder type injuries, and so when we're working with massage or talking about massage for a shoulder joint injury, we're looking at working in the muscles that attach to the shoulder itself. So we're talking about the traps across the top of the shoulder, the rotator cuff muscles, all the muscles that run in, on, and around the shoulder blade, into the lats, anything that attaches to or directly affects motion of that shoulder joint itself. A very effective method that we can employ here in the office dealing with shoulder injuries is using the deep tissue laser. And so the laser itself, what it does is it allows deep penetration into the joint. So we're talking about the muscles, we're talking about the ligaments, the tendons, all the attachments that go into the shoulder itself, helping to increase that healing level at a deep cellular level. Working with the superficial things, maybe with massage or an adjustment, this is going to get deeper into that joint to help to reduce swelling and inflammation, help to induce and speed up that healing process. Hopefully you found this video to be helpful and useful for you. If you did, like it, share it with your friends.
To find out more about the Springfield Wellness Center and all the other services we offer, head over to our Facebook page or check out our YouTube channel.